Hey guys, welcome back to another rapid update. In this video, we're going to talk about Health Technology Assessment Methods Guide, which will be used to inform the selection of new medicines as they enter the essential medicines list in South Africa. It was recently published on the 14th of June, so stick around. So this is part one in a series of recorded webinars and conversations that we'll have related to the Health Technology Assessment Methods Guide, which was recently published on the 14th of June. And this would be used to inform the selection of medicines for inclusion on the National Essential Medicine List. Potentially in the future, the same methods guide could also be used for vaccines and then also for medical devices. The purpose of these recorded videos is to provide a commentary and also to inform our clients and colleagues in international markets on developments within the South African market, what to look out for, and also how to contribute as the methods guide is developed and also as the space evolves into a fully fledged health technology assessment system in South Africa. So going forward, I will have assumed that for these recordings to be useful, that you would have already read the assessment methods guide and that you will also be familiar with the content. We're not going to be reviewing word by word or page by page what has been described in this document, but rather focusing on some of the key elements that may, as I mentioned, support our clients and also colleagues around the world as they engage in the South African healthcare system. So let's jump straight into first looking at the purpose of the methods guide. So the purpose of the Health Technology Assessment Methods Guide is to inform the selection of medicines to the South African National Essential Medicines List. And this is a very first attempt to formally put together a methods guide to inform the inclusion of medicines, particularly focused on the public sector. Take into account, again, that the public sector is responsible for covering by far the majority, close to 80% of the total South African healthcare total South African population, whereas there's also a private healthcare sector responsible for covering approximately 20%, and that's a rough estimate, 20% of the population. These guidelines or methods assessment apply specifically to the public sector, and it is envisaged that in the future it would also impact and also guide the national health insurance system as it evolves, and potentially inclusion of newer healthcare technologies when they come to market. As I mentioned a little earlier on, is that at the moment it's focused on medicines and groups of medicines, but it also will potentially in the future also include vaccines and medical devices. And the purpose of this guide specifically is to provide clear guidance on issues related to efficacy, safety, effectiveness, and affordability, and then ensure consistency of the methods and transparency in decision making. Let's have a look at the table of contents before we continue. So there are a couple of sections in here, but the majority dedicated to a detailed presentation of the technical review and additional analysis. So this is this part over here, 3.1, which is an assessment. And in that section are a few areas. So first, clinical evidence, economic evidence, equity considerations, social value considerations, feasibility, and also recommendations at the end of the stage one. Stage two is additional analysis. So here, systematic reviews, cost comparison analysis, budget impact analysis, rapid review of economic evaluations, cost effectiveness analysis, and finally pricing analysis. And this aims to define more clearly this assessment stage. What is lacking, though, and what seems to be a little thin on information, is this appraisal phase over here, which is number 4 in the document, chapter 4. But as the document remarks, is that this methods guide is work in progress, and it's very likely that in the future we'll have greater clarity on the contents and the actual decision making process and the appraisal of all of the content that is developed just above here. What is a unique contribution of this work over here is that everything has been put into or structured into utilizing templates. So the major benefit of HTA Methods Guide is consistency and comparability of reporting and gathering information. And they use a series of templates to then gather information and report the essential information in that assessment phase. So a health technology motivation template is there, scoping template, technical review report template, cost comparisons, rapid review of economic evaluations, cost effectiveness analysis, budget impact analysis, and pricing analysis. And this is all a welcome development in the sense that it provides a degree of predictability, transparency, around how this information is collected, potentially across a very diverse group of individuals, either at the National Department of Health or internationally. So the objective here is standardization of the HTA process, and this is, as I've remarked, a welcome development. There are a couple of principles, though, in having a look at the Health Technology Assessment Methods Guide that we need to consider going forward. First is the principle of transparency and who is involved in the health technology assessment process. Does the introduction of a methods guide improve transparency? And in our view, yes, absolutely. Particularly if you're utilizing a templated approach to ensure that there's a transparent methodology put together in collecting information, reporting it, synthesizing it, and then ultimately its input into a decision-making process. Although we're not really familiar at the moment of what this red box would look like, this appraisal phase over here, if one standardizes this assessment process as much as possible, it will absolutely achieve the objective of transparency. Adherence to timelines is the other principle. I don't see sufficient mention in these methods guides around timelines, and what I mean by that is how long will it take for the completion of this assessment phase, and then when it feeds into the appraisal phase, how long is it going to take for that stage over here, and then finally to get to the actual patient or inclusion on the essential medicines list. Let's not even talk about access to the individual patient, but rather inclusion onto the EML. How long will this take from assessment to appraisal to final decision to inclusion on the EML? And I think greater clarity is required around if there is a time period of 90 days, for instance, here in the appraisal phase, that 90 days is a maximum allowable period to obtain a decision. For instance, in the assessment phase, perhaps a recommendation may be 270 days, although the methods guide does mention approximate timing required in weeks or months for completion of a comprehensive cost effectiveness analysis or rapid review. They provide a few estimates on weeks and times, but it'd be useful to utilize a very specific timeline for that. So let's say 270 days to complete this assessment, and then a 90-day period for the appraisal, and then finally a decision for inclusion in the EML. This level of adherence to timelines would be a critical issue to address in the methods guide for the purposes of also ensuring that some degree of predictability is given to the South African public and also different stakeholders that are involved in this process. The other principle in HTA relates to decision making, and does the introduction of the methods guide improve objectivity in making HTA decisions? In our opinion, I think it does, and this is a positive feature compared to how it has been done in the past in South Africa, which has been somewhat on a case-by-case basis. In many instances lacking a degree of predictability and adherence to timelines, as I've mentioned. So instituting an HTA process through this methods guide would certainly improve the objectivity, especially through these templates again that I've already mentioned, and may also then assist in addressing potential conflicts of interest. And that is, if an appraisal committee is constituted, that I illustrated a little earlier on in this box over here, if this appraisal committee, if it is known who the members are, how long they are expected to make a decision, and if there's any potential conflicts of interest that have been declared or undeclared, then this would certainly improve decision making overall. And the last key principle is budget commitment. Our assumption here is that a methods guide for HTA is, in a sense, signaling the commitment of the National Department of Health and provincial structures too, to set aside a budget for funding of new healthcare technologies as they enter into the market. And this is, of course, highly sought after and absolutely required in the South African healthcare system, public healthcare system in particular. But we don't see any definitive and concrete budget commitment included in this methods guide, and this will be a subject of follow-up conversations on this in these recorded videos to talk about the cost benefit of an HTA process and the budget commitment, with some examples from international markets and how it could be potentially utilized in South Africa. These principles that I've mentioned, I'll return to on a frequent basis in these recordings to guide the conversation around key elements of the methods guide. So let's jump into the primary purpose of this recording, which is who funded this work. This question of who funded is important because it potentially introduces any bias. It helps us understand the perspective with which the authors of the methods guide is approaching the subject of health technology assessment. It also assists us then in unraveling and unpacking the linkages between the authorship of this, the funders of this, a methods guide, and perhaps provide us some insights in the future direction. This is very similar to also publication of clinical trials or observational studies, which is mostly funded by the pharmaceutical industry or medical device companies, and the usual critique that is lodged that bias may be introduced into a clinical trial that is funded by a pharmaceutical company. Utilizing the same logic, it is important as independent analysts to look at work that is put together by government to ask who the funders are, and does it also potentially introduce any degree of bias? And if so, how do we handle it, and how do we need to respond to that? So the first clue around who funded it is in the acknowledgement and authorship section of the report, and it states here that this guide was drafted by the Better Health Program South Africa by authors in consultation with the Essential Drugs, not Drugs, program, and also independent consultants. Our interest here is to determine who is funding the consultants. Is it funded by the National Department of Health, or is it funded externally? And we'd need to find out a little bit more about the Better Health program. So we did some searches to identify that, and I want to share with you the following, which is a description of the Better Health program for South Africa and a range of other countries. And it provides either details of the primary purpose, the funding, the timelines, the overarching healthcare goals, the linkages to UK businesses, a national security strategy of the United Kingdom. And just in case you're wondering where this information was obtained, this was done, this document is in the public domain. If you do a Google search with the term Better Health Program South Africa, amongst one of the results, here are some at the top, but this result here specifically, which is the Prosperity Fund Better Health Program Summary, available on this URL in an open document source. This is where that information was found, that I'll present to you in just a few moments. So this is in the public domain and available. And if you do the search yourself, you'll be able to access the same document. So what is the Better Health Program? And it is a program developed by the Foreign and Commonwealth Office, Department of Health and Social Care, Department for International Trade, and Department for International Development in the United Kingdom. Its beneficiary countries or target countries is Brazil, Burma, Malaysia, Mexico, Philippines, South Africa, Thailand, and also Vietnam. And it will run over this time period, 2019 to 2023, and it has a total of approximately £18 million that have been allocated to implement the project. The purpose of the project has two overarching healthcare goals. First is to address non-communicable diseases in each of the target countries that I've mentioned, predominantly low and middle income countries, South Africa here being the middle income country, and also to reduce premature mortality and morbidity. And here, health technology assessment clearly fits within this domain. So meeting these objectives will help advance economic development in the partner countries, but will also create opportunities for international and UK businesses as a secondary benefit. It also helps advance and here the author of this document is the United Kingdom government, our national security strategy and UK aid strategy objectives. Now, for the purpose of this video, we haven't looked up what this national security strategy is, nor what the UK aid strategy objectives are, but it is interesting nonetheless to conceptualize and to think about the practical linkages between the production of a health technology assessment methods guide and its linkage to national security and UK aid strategies in the UK. And this will be the subject for further conversation in subsequent videos too. And why is the UK supporting this? Is a rationale provided. But the primary purpose here, the UK's experience and expertise in NCD prevention strategies, providing improved quality education and training, can help partner countries address the NCD challenge. UK NHS expertise in particular is highly sought after by the 8 program partner countries. The program supports the objectives of national security and UK aid strategy that we've already covered. Other key sections of this document is, let's have a look, that £1.5 million has already been set aside in the first financial year for staff costs and scoping and design work by a consortium of UK government organizations in each of the partner countries. And they focus on 5 key interventions, as I've mentioned some of them. NCDs, provider quality improvement, digital health, education and training, life sciences R&D partnerships, which would be presumably establishing joint partnerships between institutions in South Africa with UK researcher institutions as well. And the final secondary benefits related to Better Healthcare Program is for international and UK businesses and organizations. UK businesses and organizations, including NHS trusts and academic institutions, possess distinctive world-leading capability and will be well placed to benefit from the future opportunities created by the program's technical assistance in these fast-growing markets. The program is expected to lead to increased demand for goods and services across the healthcare sector and will be engaging suppliers. So having reviewed this rather extensively, and this document is in the public domain, it's clearly a business development aid being set aside to support consultants, academic institutions, UK businesses in providing products and services to South Africa, and also these group of countries. In the South African context, it's taken the form of Health Technology Assessment Methods Guide. In other countries, it may be different. So, having said that, let's jump into kind of thinking about this a little bit more around the implications of who is funding it now that we know that, but why is it being funded? We've already mentioned that, which is the encouraging goods and services being procured and purchased from the United Kingdom, hopefully with some spillover effects for South African suppliers and also capacity building in South Africa too, which is a subject that we'll return to in subsequent videos as well. But let's think about it from two polar opposites. And one thought that comes to mind was a recent paper that was, or commentary that was published by this group of co-authors here on decolonizing global health. Where are the Southern voices? And I'm presenting this not because I necessarily agree with these opinions expressed in this piece. It's simply to demonstrate the polar opposites on how one would think about donor funding for an HTA methods guide in South Africa and the potential implications that it has in the future going forward. So one approach is this over here, where these authors remark that there's this rising wave of discontent with power imbalances. With the funding of an health technology assessment methods guide, ostensibly and predominantly from the global north, further entrench power imbalances that exist at the level of the global south and its capacity to independently do health technology assessment. If you view it from the perspective of these two co-authors, and by the way, this was published in the British Medical Journal not too long ago, so this was a few weeks ago, July the 8th, 2021. If you see it through their perspective over here, they're clearly arguing for some degree of independence and sovereignty amongst countries to be able to pursue their own agenda in health technology assessment, independent of funding from global development agencies. One key paragraph in what they mentioned here is, however, for those of us in the global south who continue to endure the suffocating legacy of colonialism in global health, we simply cannot wait for the emergence of a dominant design. We simply cannot wait for the reimagining and rebuilding of the global health field as has been called for by some of our counterparts in the global north. Therefore, we have decided to throw ourselves headfirst into the sphere of pragmatic action rather than wait on a dominant design. So if you look at the HTA methods guide through the perspective of what these authors are saying, they are clearly suggesting that some form of decolonization of HTA processes is required in the Southern Hemisphere, but more specifically in South Africa as well. I don't agree with these thoughts, but it's nonetheless an important thought to entertain and to see what it would result in. The other approach to think about this is on a basis of meritocracy. And here I've pulled up a basic definition of Wikipedia. It is a political system in which economic goods and political power are vested in individual people on the basis of talent, effort, and achievement rather than the wealth or social class. And the emphasis here is that meritocracy is based on performance, and demonstrated achievement as well. Those are all key words. Our unit of analysis here is at the level of a country, so the country of England in particular, that has been able to harness a group of individuals with highly talented individuals, significant achievements in the past as well, that have demonstrated achievement in doing health technology assessment systems for their NHS. If you approach the Health Technology Assessment Methods Guide through the perspective of meritocracy, it means that absolutely the South African National Department of Health should be engaging through the Better Healthcare Program, the NHS system, and then also NICE International in particular, and NICE as well, on all the products and services that they currently offer that could potentially benefit the South African population. And when you take these two polar opposites of meritocracy versus decolonization, somewhere in between is perhaps a happy medium. Meritocracy, from the perspective of those that seek to decolonize health technology assessment processes, it's diametrically opposed. So anyway, let's jump off this point over here and ponder for a moment what we should expect to see, having understood first who is funding it, why is it being funded, these polar opposites of decolonization versus meritocracy, and what should we anticipate in this work. First is, it's very likely that given the origins of the funding, that suppliers, contractors, consultants on this Health Technology Assessment Methods Guide are mostly going to be extracted from the United Kingdom. It's very likely as well that outsourced contracts for assessments and then also for appraisals would be integrated and depend on the utilization of United Kingdom and English academic institutions, and also businesses within the United Kingdom. What this donor funding does inevitably is that it displaces meaningful opportunities for domestic academic institutions and also for independent consultants to be able to contribute to the development of an HTA system that is a little bit more organic and homegrown. And the last remark is, if one approaches this from the perspective of wanting to decolonize HTA systems in sub-Saharan Africa and then also Middle East, a thought may be that of somewhat surprise that the National Department of Health has not chosen to engage local providers and academic institutions in building capacity to be able to sustain a health technology system in the future. This may be either a disservice. This may be a disservice to the South African society and South African public at large. If you approach it rather from a basis of meritocracy, is that perhaps the strategy and the objective of the National Department of Health is to, through an interim period, seek additional capacity and expertise, with the hopeful objective to translate those and import them into the South African environment in order to develop a more homegrown and organic approach. This would be more aligned to meritocracy. And it's difficult to tell at the moment from just the contents of this document what the ultimate intention and what the approach should be, given these two polar opposites of decolonization on one end and meritocracy on the other. So anyway, so that's a wrap for this video. And in summary, what we've covered is talking about the principles of HTA and how it may guide an analysis of the methods guide. We've also spoken about who funds this work, why is it being funded, and then also what are the potential future implications in thinking about how methods guide or health technology assessment may look like 5 years down the line or 10 years down the line from the perspective of critical race theory or this idea of decolonization of health technology assessment versus the alternative approach, which is based on meritocracy. I hope you found that interesting. Stay tuned and watch out for subsequent videos as well. Thanks so much. Take care. Bye.